Hello, my dear friends. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. What are we studying today? Larynx part 2. Okay. Why is she here standing with a mic? Because you speak through your larynx, isn't it? Last time we did some diagrams of larynx. Okay. So let's ask ourselves, what do we know about larynx? So this was a diagram drawn by you, which taught you that there's an epiglottis, hyoid bone. Hyoid is attached to the thyroid cartilage with the help of thyroid membrane. Laterally, it thickens to form a lateral thyrohyoid ligament. Then we saw the thyroid with an oblique line on it. We saw the posterior lamina of it rising up to form the upper and lower horn. This was the cricoid cartilage. The lower horn is seen articulating with it to form a joint. And here anteriorly you saw a conus elasticus. So this is what we learned in our last diagram. We also drew this diagram which showed us how epiglottis peeps up quite clearly above the hyoid bone. This is the thyroid membrane which shows a little foramen in it for the superior laryngeal vessels to enter inside. Then we saw again the thyroid cartilage, the cricoid cartilage, conus elasticus and cricotracheal membrane attaching the cricoid cartilage to the first tracheal ring. Then we drew the same larynx as we would draw from posteriorly, and we saw that posterior view gives us a complete view of epiglottis and which shows a little tubercle in it, and it also showed us all the paired cartilages, the two cuneiform, the two corniculate and the two arytenoids sitting on the lamina of cricoid cartilage. So this is what we know. Okay. Now what we're going to do is we are going to learn all these cartilages, their structure, the ligaments attached, muscles attached. Okay. Have patience. Sit with some sheets of paper. See, I'm sitting with a sheet of paper with a pencil. I also have a scissor which I have not kept to show you. But you have to sit with that because learning larynx means this time cutting out cutouts of cartilages. Okay. And if you feel that, ma'am, this is too difficult, then I have attached a PDF. Just print out the PDF. It has already got the diagrams drawn on it. All you have to do is cut them out. Right? Either ways, have a model of larynx with you. Okay. You will see that this is not my unique way. This is just the way for a long time many of us have learnt about larynx, because for understanding larynx you have to have something in your hand. Okay, you have to have the cartilages to really understand them. So what did we learn from our earlier diagrams? We've learnt all of this. I'm not going to read it. I'm sure you know all this now. To study individual laryngeal cartilages, I am requesting you to join in and participate in activities. I hope you will do that. Let's begin by studying first the epiglottis. So yes, this is an activity. I want you to take the piece of paper, I want you to take a pencil and draw the cutout of the first cartilage, the epiglottis. Remember, epiglottis is shaped like a leaf. So let us pretend that you're drawing a leaf. Come, let's take a piece of paper in our hand. I'm going to fold this, okay? Right? Fold it. Now all I have to do is draw a leaf, right? So what do? I draw half the leaf here, okay? Wide above, narrow below. So I take a scissor and I cut. It's a unique experience for me to be teaching craft when I'm teaching medicine, but everything works. The aim is to have knowledge. It doesn't matter how you get it, how idiotic it is, how simple it is. We should learn. This, my dear students, is epiglottis. If you have this epiglottis in your hand, it makes understanding epiglottis much easier for you. Okay? So take your epiglottis along and let's begin to learn anatomy of epiglottis. Okay? So let's begin to learn about the epiglottis. We have one of our own now. Let's begin. So as you can see here, the epiglottis is leaf-shaped structure. Let's remove the leaf. You've got the idea, right? So it has an upper end, it has a lower end. It has an anterior surface which is convex and a posterior surface which is concave, and it shows a tubercle. So now let's use our model. We have a model, we have an epiglottis with us, right? So now as you can see, the epiglottis has an upper end, has a lower end, okay? Bend it a little bit, okay? Hold it obliquely. It has a convex anterior border or anterior surface and a comparatively concave posterior surface. Okay, now let's take a pencil and draw a tubercle here. Can you see the tubercle I have drawn here? So now this tubercle is the tubercle of epiglottis. Is that clear to you? Upper end, lower end. Obliquely, anterior surface, posterior surface. On the posterior surface, I can show you that I have drawn a little tubercle here. That's the tubercle of epiglottis. Is that clear? Okay, come. Leave that down and let's begin to study the epiglottis. Okay. Right. So as you can see here in this image, the epiglottis has this is the epiglottis. It has an upper end which is free behind your oral cavity. In your oropharynx, your epiglottis is placed obliquely. Here, this is the upper end and this is the lower end. The lower end is attached to thyroid cartilage with the help of thyroepiglottic ligament. Is that clear? So now understand that this is your epiglottis, which will be placed at an angle in your body. Okay, so this is the upper end I'm talking about, and this is the lower end. This lower end is very close to thyroid cartilage, to which it gets attached with the help of thyroepiglottic ligament. Clear? Right. So now, this is the anterior surface, which is attached to the hyoid bone with the help of hyoepiglottic ligament. See, what are we doing? We are basically anchoring the epiglottis in place. You don't want it to fall back here and close off the entry into larynx. You want it anchored there, so you're anchoring it. Upper end of epiglottis is quite free, as you can see. Covered by mucous membrane. This black line represents mucous membrane. And this mucous membrane now reflects onto the dorsum of your tongue. So there is a little depression between the tongue and the epiglottis. This depression is called as the vallicula. Okay, and there are 3 folds which are connecting your tongue to the epiglottis. I'm not able to show you that image because it becomes too much. Show too many images and the point gets lost sometimes. Just understand that the tongue is anteriorly, epiglottis is posteriorly. Okay, attaching the tongue and the epiglottis are 3 ligaments. Median glossoepiglottic ligament and 2 lateral glossoepiglottic ligament. Glosso is tongue. Glossoepiglottic ligaments. Okay, something like this. And there are depressions in between on either side which are called vallicula. If you're getting this, fine. If you're not getting it, temporarily put it away. It's fine if you don't know this. Okay, right. So we've done the anterior surface, upper and lower end. Here you will see that there is a little projection. Are you able to see the projection? This projection is called as the tubercle of epiglottis. Remember, we've drawn it here. This is the tubercle. Now here, there is a fold. As you can see, here's the arytenoid cartilage and here is the epiglottis. And extending from arytenoid to the epiglottis, there is a fold of mucous membrane called Aryepiglottic fold. I want you to say it once. Aryepiglottic fold. Going from whom to whom? From arytenoid to epiglottis cartilage. Clear? Right. So we need to learn about Aryepiglottic fold now. Okay. Understand that this is a very important fold in larynx, containing 2 muscles, containing 2 cartilages. I think you already know which 2 cartilages, corniculate and cuneiform. And 1 membrane called the quadrate membrane. So I'll be teaching you about this. But first, let's learn about the 2 muscles. So here is your Aryepiglottic fold. This is your arytenoid cartilage. This is your epiglottis. So this therefore is your aryepiglottic fold. When I dissect this, I find there are two muscles below it. Aryepiglotticus and Thyroepiglotticus. Now how easy it is to learn these muscles? You can see they take origin, the Aryepiglotticus takes origin from which cartilage? Arytenoid cartilage. Where does it get attached? Epiglottis. Simple, you can see the whole muscle in the diagram. Similarly, Thyroepiglotticus takes origin from thyroid cartilage, goes to epiglottis. So you know the origin insertion by just looking at the diagram. Okay. So we've finished the two muscles. Now let's go to two cartilages. What are the two cartilages? Yes. This is your aryepiglottic fold and the two cartilages are corniculate and cuneiform. So two muscles are done. Which two muscles? Aryepiglotticus, Thyroepiglotticus. One coming from posteriorly, one coming from anteriorly, going to attach itself to the epiglottis. Two cartilages, corniculate, cuneiform. Then one membrane called the quadrate membrane. Now you can see that it has got four borders. It has got four borders. Okay. One border is attached to the epiglottis. One border is attached to the arytenoid. Okay. The upper and lower border are free. Pay attention to this because it's very important later. Later in our study of larynx, it's going to matter. Anteriorly attached to the epiglottis, posteriorly attached to the arytenoid, superiorly free to enter into which fold? To enter into the aryepiglottic fold. Inferiorly free to hang into the larynx as a thick ligament. Can you see that it's not just a line, it's a thick ligament called the vestibular ligament. What is vestibular ligament? It's the lower thickened edge of which membrane? Quadrate membrane. Okay. So you have learned quite a bit, quite a lot of important stuff in these last 2-3 minutes. Okay. Let's revise what we learned. We learned about thyroepiglottic ligament. We learned about hyoepiglottic ligament. Then you learnt about median and lateral glossoepiglottic fold and vallecula. Like I told you, you can use images to study this, but you needn't bother at this stage. Then we learnt about epiglottic tubercle, a tubercle on the dorsal posterior surface of epiglottis. Then we learnt about aryepiglottic folds. But my question is, and your question also should be, why are we learning so much detail about epiglottis? So if you're liking my lectures, do like and subscribe to my channel. So now we come to the point. Why are we learning so many details of epiglottis? Come. Why did I teach you aryepiglottic fold? Why did I teach you contents of aryepiglottic fold? Okay, all this is always for a functional reason. All right, come, let's learn this. Remember, this is your epiglottis. And these two, my fingers, represent the aryepiglottic folds. Can you see that? Between the epiglottis and my fingers, okay, there is a clear foramen created. I'm going to show you with this pencil. There's a clear foramen created. This foramen that gets created is called as the laryngeal inlet. Can you imagine that this is the space through which air enters into your larynx every day. Every minute that you breathe, air is passing through this little gap, in and out, in and out. See, epiglottis, aryepiglottic folds, and air passing through, in and out. Okay, so this is the gap or the laryngeal inlet through which larynx communicates with the pharynx. Clear? Pause the video if you're not clear about this because this is very, very important. Okay, so now let's try and breathe. So you have started to breathe in air. As the air enters into your pharynx, okay, it finds an inlet there. It finds the laryngeal inlet here. It quietly passes through the inlet into your trachea. Do it. Feel your trachea here and take a deep breath. Can you feel the air passing through? How has the air passed through? It has passed into your nose, it has entered into your pharynx, it has passed through your pharynx, through the inlet into your trachea. So the inlet is the entry point through which air enters into larynx, then into trachea, and then into your lungs. So inlet has to remain open. What will happen if your inlet closes? You cannot breathe. Okay, fine. So let's talk about the day you started to eat something. Let's suppose you're eating something. Okay, so here's your inlet. Note the inlet. Okay, you have started eating something, whatever you like. Okay, so food has entered into your pharynx now. Okay, now food has got options. Food can pass through the inlet into your trachea. It can pass directly down through the pharynx into the esophagus. But do you want your food to enter into your trachea? Definitely not. So what are you going to do? But inlet is there. Food has got both the options. What you need to do is to close your inlet. Whenever you're eating, the inlet of larynx has to close. Then only food enters directly into pharynx and down into your esophagus, which is the right way for the food to go. Clear? So with this, we come to a question of laryngeal inlet opening and closure. What opens your laryngeal inlet? What closes your laryngeal inlet, and why? Clear? So that's the reason why we were studying so much anatomy. Okay, so the inlet of larynx, let's learn the boundaries first. Bound anteriorly, you've seen that. This was the epiglottis. These were the aryepiglottic folds. So you already know the boundaries. Let's just put it on the screen. Anteriorly bound by the epiglottis. On the side bound by the aryepiglottic folds containing all this. And posteriorly bound by interarytenoid mucous membrane. I'll show you all this. Just remember, this contents of aryepiglottic folds is something you have to learn. Go back and revise. I won't keep revising it, otherwise it gets very boring and the video becomes very long. Okay, so let's look at this. Orient yourself. This is your epiglottis. You're looking at the whole epiglottis, which means you're looking at it from posteriorly. Very nice. This is your tubercle of epiglottis. These two are your pair of arytenoid cartilages sitting on the lamina of cricoid. Okay, now, as you can see from the tip of arytenoid, a muscle is going towards your epiglottis. From the tip of arytenoid, a muscle is going to your epiglottis. This muscle is called Aryepiglotticus. We've done this, so I won't do it again. Aryepiglotticus, from arytenoid to epiglottis. It is covered by mucous membrane, forming the aryepiglottic fold. Fold are mucous membrane. Muscle lies below them. And attaching the two folds to each other is the interarytenoid mucous fold. So these two arytenoid cartilages are attached to each other over here. Okay, by a mucous fold called interarytenoid mucous fold. As you can see, we have developed a little foramen, isn't it? This one. And it is through this foramen that every day you breathe in, breathe out. Breathe in, breathe out. Okay. So this is the laryngeal inlet and these are the boundaries of laryngeal inlet. Now my question is, let's revise it quickly. Anteriorly epiglottis. On the side, aryepiglottic folds containing two muscles, two cartilages, one membrane. And posteriorly, interarytenoid mucous membrane. Clear? Okay. Now, how do you open the inlet? How do you close the inlet? Remember, this was your epiglottis here. And these were the two aryepiglottic folds with the tubercle here. Clear? So what happens is, when you want to close the epiglottis, the arytenoids, literally the Aryepiglotticus muscles crumple towards the tubercle. And then the epiglottis bends a little bit. I want you to understand this carefully. Think, epiglottis, tubercle in the center. Aryepiglotticus muscles on both sides. When they contract, they literally crumple towards the tubercle. Okay? A lot of people believe that epiglottis would fall back and close like a lid, but it doesn't happen. Even if you cut off the top of epiglottis, the inlet continues to close and open automatically. So the epiglottis is not a lid. The aryepiglottic folds are just crumpling towards the tubercle of epiglottis. That is why tubercle of epiglottis is important. Okay. So how does inlet close? By contraction of Aryepiglotticus muscle. Pulling the aryepiglottic folds towards the tubercle of epiglottis. How does laryngeal inlet open? It opens basically by just recoil. Just the recoil causes the inlet to open with a little help by Thyroepiglotticus muscle. So, let's finally revise what are the actions of Aryepiglotticus and Thyroepiglotticus. Aryepiglotticus causes closure of inlet. Thyroepiglotticus assists in opening of inlet of larynx. Why do you want to close inlet? Because you don't want food to enter into your larynx when you're eating. Okay. Why do you want to open the inlet of larynx? Because you are breathing, living human being. You need air to enter through the inlet into your larynx, trachea and lungs and out again. So most of the time you want your laryngeal inlet to be open. You want it to close whenever you're eating food so that food does not enter into your larynx. Yes? Okay. So with this, let's ask ourselves, what did we learn with epiglottis? We learned the shape and structure of epiglottis. We learned ligaments that hold your epiglottis in place. See, this is your obliquely placed epiglottis. It's attached here to the thyroid cartilage. It is attached here to the hyoid bone. Thyroepiglottic ligament, hyoepiglottic ligament. Then we learnt about its tubercle. Then we studied the boundaries of inlet of larynx, its communication, aryepiglottic folds and the contents 2, 2, 1, 2 muscles, 2 ligaments and 1 membrane. Then we talked about actions of Aryepiglotticus and Thyroepiglotticus while discussing the opening and closure of inlet of larynx. Okay, so we've completed our discussion on epiglottis and we've completed our discussion on inlet of larynx. Okay, we've also completed our discussion about 2 muscles, Aryepiglotticus and Thyroepiglotticus, right? So, epiglottis done, inlet done, aryepiglottic folds done, Aryepiglotticus, Thyroepiglotticus done, and opening and closure of inlet done. Done quite a bit, but there is still the thyroid cartilage to go before we can rest for today. So, let's now begin study of thyroid cartilage. I suggest you pause because now we're going to go into the second discussion that is on thyroid cartilage. Okay, so let's ask ourselves, where is this thyroid cartilage? Yes, you can palpate it. I can palpate my thyroid cartilage. Boys can find their thyroid cartilage so much easily because it protrudes out in the form of an Adam's apple, right? So this is your thyroid cartilage extending over C4, C5 vertebrae. And now I want you to understand the shape by doing the same thing that we did for epiglottis, paper cutting. So this is a sheet of paper. I am going to fold it, not lengthwise, I'm going to fold it widthwise. Now, I'm going to draw a thyroid cartilage on it. Again, drawing thyroid cartilage is not difficult, but it's not exactly easy. So, my suggestion would be use the PDF that I've given you. However, if you're smart and you're good at drawing, then my suggestion is, come, let's draw. Okay, remember, this is the shape and I've drawn the shape for you. Okay, this is the shape that I want you to draw. This is 1/2 of thyroid cartilage that you're going to see. So remember, hold the paper in this manner, not like this. Hold it at an angle. Okay. It's just a marker for me. Okay. So hold it at an angle. Draw the thyroid cartilage as shown here. Okay. Take your scissor and begin to cut it out. Okay, come, cut it out. Right. So that completes our thyroid cartilage. Remember, it's a folded sheet. So it's going to open out to become like this, the pretty little butterfly. Okay. So this is the thyroid cartilage that you must have in your hand to be able to really understand the topic of thyroid cartilage. It's okay if you have an amazing imagination. Maybe I don't have a great imagination. I like having a thyroid cartilage in my hand, okay, when I'm teaching as well as when I'm learning, okay. Just a second. Remember, we've also cut out the epiglottis, okay. Take the epiglottis and stick it in. Okay, does that show you the lateral view, the beautiful lateral view of larynx? Okay, all you have to do is imagine a hyoid bone here, and there you have a paper cutout of your larynx. Okay, so now let's keep the epiglottis away. Use our thyroid to study the thyroid cartilage. Come. So let's study it. So this is the thyroid cartilage in your hand. Please use that for understanding. I'm going to use the screen to explain. Here I can see the thyroid cartilage. As you can see, it has two laminae, a right lamina and a left lamina. Okay, so hold it like this, right lamina, left lamina. It has an anterior border where the two laminae meet. It has a portion of it which projects. See, remember, it has a part that's going to project forwards here. This anterior projection is called the Adam's apple, and it's about 90 degrees in the male and 120 degrees in the female. It's there. That is the reason why we females have a rounded neck, whereas men have a very pointy neck. Not that we are complaining, everything is fine, okay? But that's the way it is. And here is the posterior free edge here, which rises up as the upper horn and rises and descends down as the lower horn. So superior horn, inferior horn. And on the side, the thyroid cartilage has an oblique line. So our model does not have. So take a pencil and draw the oblique line. What is stopping you? So I'm going to draw an oblique line here, and I'm going to draw an oblique line here. That's my oblique line. Right. So now, if you look carefully, the lamina of thyroid cartilage is almost a quadrangle. Okay. It has a superior border, inferior border, upper border, lower border, anterior border. At the anterior border, you can see how the two laminae meet. Upper border, lower border. Anterior border, a border where the two laminae meet and fuse. And a free posterior border, outer surface and inner surface. For each lamina, I'm going to have to study these parts. Upper border, lower border, anterior border, posterior border, outer lamina, inner lamina, or outer surface, inner surface. Clear? Come. So now, this is the hyoid bone, this is the thyroid cartilage, and this here is the upper border. So what do we know about it? I don't want to teach you. You should know that the upper border is attached to the hyoid bone by a thyrohyoid membrane. And the thyroid membrane thickens laterally to form the lateral thyroid ligament and anteriorly in the midline to form the median thyroid ligament. So clear superior border being acting as an anchorage, anchoring the larynx to the hyoid bone. Now this is the lower border. Okay, as you can see, the lower border is initially quite straight and later on forms this little curve as it continues down to form the inferior horn. This lower border anteriorly gives attachment to the conus elasticus. We've done this ligament earlier. But the rest of the lower border gives attachment to this beautiful muscle, the cricothyroid. What do you know? Just ask yourself, cricothyroid. From what to what? From cricoid cartilage to thyroid cartilage. Very simple, somewhat obliquely placed muscle. From cricoid anteriorly to thyroid a little more posteriorly. So what is cricothyroid muscle? A muscle that takes origin from cricoid cartilage, with the fibers directed upwards and backwards, inserted into the lower border of thyroid cartilage. Very easy, right? So we ask ourselves, how does this act? How does it act? Okay, that's what it's all about, right? So remember, this muscle is called as the tuning fork of larynx. Why? Because, let's take a look. Now, this is a diagram which is the thyroid cartilage part of it is quite familiar to you. Rest of it is a little bit of difficulty. So let's understand. This is your adenoid cartilage posteriorly, attached with the help of a vocal ligament to the thyroid cartilage. See here, this is your thyroid cartilage. To this posterior surface of thyroid cartilage, the arytenoid gets attached with the help of a vocal ligament that you're seeing on the screen. Now, this is your cricothyroid. When it contracts, what it does is, see, this is your thyroid cartilage. Okay, cricothyroid is attached to it here. When it contracts, it just pulls your thyroid forward. This is your thyroid, it just pulls it, tilts it forward in this manner. Please practice that. Okay, it's here, it's getting tilted forwards here. When it tilts forward, rest of the cartilages remain in their place. Arytenoid remains in its place. Okay, so your thyroid cartilage has moved forward. Now, the vocal ligament, therefore, is stretched. Posteriorly, the arytenoid cartilage refused to move. I will not move. I will stay in place. So, the thyroid which has moved forwards, therefore, results in a stretching of the vocal ligament. Okay? I don't know how many of you have played a guitar, but you need to have the string stretched to be able to create correct sound, isn't it? So, now our vocal ligament has got nicely stretched. And when you speak, you are able to produce the right kind of sound. That is why we say that our cricothyroid muscle is the tuning fork of larynx. When it contracts, it pulls the vocal ligament, which is responsible for production of variable types of sound. Okay, so the result of contraction of cricothyroid is increasing the distance between the arytenoid here and the posterior surface of thyroid cartilage, resulting in tension of the vocal cords and vocal ligament, which is the content of vocal cord. Okay, that's how your cricothyroid contracts, and that's how it acts as a tuning fork of your larynx. Right. So we've studied cricothyroid muscle. Let's talk about now the anterior border. This is the anterior border of larynx. Okay. When I open the larynx, this is the posterior surface. This is the posterior surface of the anterior border, isn't it? This is the anterior part of anterior border, which you can actually palpate. And this is the posterior part of the anterior border, which is facing inside the lumen of larynx. Okay. If you look at the diagram here, you find that there are a lot of structures attached on that posterior part of the anterior border. Okay. First ligament is very familiar. It's where the epiglottis comes and gets attached. So it's the attachment of thyroepiglottic ligament. For one last time, I'm going to show you again. This is your epiglottis. This is how it's related to your thyroid cartilage. If you look carefully, here the epiglottis is attached to your thyroid cartilage. Is that clear? So this is where your epiglottis is getting attached to the thyroid cartilage with the help of which ligament? Thyroepiglottic ligament. Okay. Below that, you can see two little attachments, a pair of attachments above and a pair of attachments below. This is vestibular ligament. All right, I have a question for you. What is vestibular ligament? We've just done that. Remember, the lower free edge of the quadrate membrane thickens to form the vestibular ligament. You have to repeat this. Okay, remember, larynx is about going back and going forward. You can't say I've studied it. You have to go back and check. Vestibular ligament is the lower free edge, thickened edge of the quadrate membrane. What was quadrate membrane? It was a membrane that entered into the aryepiglottic fold, giving it support. So these are the two vestibular ligaments of both sides, and below that these are the two vocal ligaments of both sides. Now what do I know about vocal ligament? Vocal ligament is a ligament within the vocal cord. Every time my cricothyroid contracts, the vocal ligament gets stretched. That much I have learnt in the last 1.5 lecture. Besides the vocal ligament, you can see three muscles being attached. They are from medial to lateral: Vocalis, Thyroarytenoideus, and Thyroepiglotticus. Why have I put a tick mark for Thyroepiglotticus? Yes, I've put a tick mark because we've already studied it. That means which two muscles do we want to study? We want to study Vocalis and Thyroarytenoideus. Come. Now, this is a transverse section through the larynx. Please orient yourself. Okay. Anteriorly, this big. So, this is what you're looking at, something like this. Okay. You're looking at a section through the thyroid, through the larynx. Okay. You're looking at a section through the larynx. These two are the arytenoid cartilages. This is the lateral surface of the arytenoid cartilage. This is the vocal process of arytenoid cartilage. Don't become upset that I'm not understanding this because we've not covered arytenoid cartilage. Sometimes you have to move forward accepting that arytenoid cartilage has a vocal process and it has an anterolateral surface. This is one arytenoid, this is the other. Extending from in front here on both sides are the two laminae of thyroid cartilage. This we understand. And extending from the vocal process to the thyroid cartilage on both sides are ligaments called vocal ligaments. I want you to just imagine these two fingers of yours extending posteriorly to the arytenoid and anteriorly getting attached to the thyroid cartilage. On the side of vocal ligament, you will find vocalis. See how it's attached lateral to the vocal ligament, and thyroarytenoid further lateral to it. So from medial to lateral, you will have vocal ligament, vocalis, thyroarytenoideus. Vocal ligament, vocalis, thyroarytenoideus attached here. Why are we studying this? What is the origin of vocalis? What is its insertion? Origin, vocal process. Insertion, thyroid cartilage, posterior surface. Origin of thyroarytenoideus, anterolateral surface of arytenoid cartilage. Insertion, thyroid lamina. Posterior surface of lamina of thyroid cartilage. This much we can see from the diagram and we can understand. Okay, but what is the action and why are these muscles there? That's the question. So understand that your vocalis muscle is variably attached to the vocal ligament. Remember, vocal ligament is the tuning fork that's going to make the sound. So vocalis is variably able to tense and relax your vocal ligament. Okay? It's able to cause tension as well as cause thickening of the vocal cords. This helps to regulate the pitch of your voice, the tone of your voice, and the volume of the voice. Meanwhile, what is thyroarytenoideus doing? Thyroarytenoideus is basically contracting to pull the thyroid cartilage to the arytenoid, relaxing the vocal cords. So, cricothyroid was tensing the vocal cords. Thyroarytenoideus was relaxing the vocal cords, and vocalis was variably relaxing and tensing the vocal cords. Okay? So, thyroarytenoideus helps to reduce the pitch, helps you when you want to speak in a softer voice. It's thyroarytenoideus which is going to come into play. So, what did we understand? We understood that cricothyroid stretches the vocal ligament. We understood that vocalis and thyroarytenoideus relax the vocal ligament. Vocalis has variable relaxation. Thyroarytenoideus just plain relaxes the vocal ligament. Between these three muscles, they are able to enable speech, singing, and other vocalizations by variably changing the thickness, the tenseness of your vocal cords. Isn't it amazing? These three muscles, they are tiny. If you dissect the larynx, you'll find that they're so tiny. It really takes a really good dissector to be able to dissect these muscles. And they control your voice. They control the tone of your voice, the slight inflections in your voice, the rising volume, and the softening of your voice. Isn't it amazing? I find it beautiful. So we've completed the upper border, lower border, and anterior border of the thyroid cartilage. What is left to study? The posterior border. this posterior border, okay? This posterior border gives attachment to three muscles: palatopharyngeus, salpingopharyngeus, stylopharyngeus. If you've studied pharynx, then you know that these are longitudinal muscles of pharynx. Every time you swallow, they help to lift up your larynx up and down, okay? These are the longitudinal muscles of pharynx. So you can see this is the superior horn and this is the inferior horn. You know superior horn is attached to hyoid bone with the help of lateral thyroid ligament. You know the inferior horn here articulates with the cricoid cartilage to form a synovial joint. A joint between the two cartilages is the very reason why your thyroid cartilage can tilt forward and back, forwards and back when cricothyroid acts. Please use this, okay? Imagine that your thyroid cartilage is anchored to cricoid here and then allow your thyroid cartilage to fall forward, backward. When it falls forward, tenseness of vocal ligament. When it goes back by thyroarytenoids, relaxation of a vocal ligament. You have to do all this to really understand. This is the oblique line which gives attachment to three muscles. Sternothyroid from below, thyrohyoid passing up, and from the pharynx, the inferior constrictor. Between the sternothyroid and inferior constrictor, if you can see, here is the thyroid gland, which gets sandwiched between these two muscles, rising halfway to the thyroid cartilage. Okay? Can you name this muscle, please? Yes, I like to ask questions. Come on. What is this muscle going from cricoid to thyroid? Cricothyroid. This bone? Hyoid bone. This membrane? Thyrohyoid. From thyro to hyoid. Thyrohyoid. So, in the thyroid cartilage, you learnt details of cricothyroid, vocalis, thyroarytenoideus, how they tense and relax the vocal cord and ligament to help you create various kinds of sounds. You also touched upon longitudinal muscles of pharynx and other muscles attached to the thyroid from outside. Remember, while these are intrinsic muscles, these are extrinsic muscles which also have their own influence on larynx. So what did we learn today? We've learnt about two cartilages, epiglottis and thyroid. We still have the rest of the cartilages to discuss. We've learnt about details of quite a few muscles. Which muscles? Aryepiglotticus, Thyroepiglotticus lying in the Aryepiglottic fold. Vocalis, Thyroarytenoideus, cricothyroid attached to the thyroid cartilage. These are the muscles, 4, which we still have to study in the next lecture. We also learnt about the quadrate membrane and how it thickens inferiorly to form the vestibular ligament, its upper free edge lying within the aryepiglottic fold. We also learnt about the inlet of larynx, how it opens and closes and why. So that completes lecture 2 on larynx. I'll see you in lecture 3. I hope you studied, understood, and will revise before you come for the next class. Bye.